TRT World's health correspondent Nicola Hill, who joins us now live from London. Nicola, good to see you. You know, I was speaking yesterday to a friend of mine in London who had COVID during lockdown 1, and she said she just cannot shake off, you know, these long-term effects. Tell us more about this study and its findings with regard to mental health.
Yeah, like you, Maria, I've got several friends actually who are suffering from long COVID months in, and they really are struggling with this. But this study was mainly done in the United States, although the lead authors are from Oxford University here in the UK. And it's basically saying that 1 in 3 people are either suffering from mental illnesses and disorders, such as you said, anxiety and depression. I think it's 1 in 17 people have been diagnosed with anxiety after COVID, and or they're having neurological problems such as strokes, and it's like 14% of people who have come out of hospital supposedly cured then actually end up having a stroke. Or, as you say, dementia. That's a very small number. And you do have to bear in mind that a lot of the people who are hospitalised with coronavirus are elderly and are more likely to suffer from dementia. So this is something that needs to be researched a lot further. Professor Paul Harrison from Oxford University has said the numbers might be small, but if you think about the massive scale, this really is going to have an impact not only on people but also on society, how we're going to look after them. And they don't know why. So is it with the anxiety and the depression, is that because of simply the stress of having the virus, dealing with the virus, having been in hospital, having to deal with long COVID? Or is it the fact the virus itself is having an impact on the brain, and that's why it's causing these strokes and everything like that? So I'm having very weird sounds here, so I'm hoping you can hear me, because I'm certainly having a problem with the sound there.
We can hear you.
But anyway, so that's basically the main thing, and that's why they're having to do an awful lot more research to see if they can work out what's going on. Now, there's a big study that's beginning here in the UK that's going to be looking into that. So they're hoping that that might give some answers, but they don't know when that's going to be.
All right. And lots of questions there, clearly. And Nicola, tell us, the big question is, of course, another big question is, what is that link between the AstraZeneca jab and potentially its potential for blood clots?
Yeah, I think you were asking me there about the AstraZeneca jab, Maria. We're waiting to hear. The European Medicine Agency are going to be speaking in a couple of hours. They're going to have a press conference. They've been looking yet again at this vaccine because of this alleged link. They don't know whether it's a causal link with the vaccine and blood clots, but what they do know is that definitely people are concerned about it. So I've got a couple of figures here I can tell you. So in the UK, for example, there's been 18 million doses of the AstraZeneca vaccine given. There's been 30 cases of blood clots and 7 people have died. So you look at the figures and it's, you know, tiny. In Germany, where, if you remember, initially they weren't giving the vaccine to people over the age of 65, there's been something like 3 million vaccine doses given, and 31 people have had blood clots and 9 people have died. Again, they're thinking it's more likely to be younger people and women. You have to bear in mind as well that being on the birth control pill really increases the risk of blood clots, but something like 0.01 to 0.02. I mean, absolutely tiny numbers here. But we're going to find out from the EMA in a couple of hours. In the UK, the study into the use of the vaccine on 6 to 16-year-olds has been halted on a temporary basis, not by the government, but by the trial runners at Oxford University themselves, just until they find out what's happening with the results of the EMA's investigation. But I know you had a guest on earlier this morning who's a doctor saying that he's about to have his vaccine. He's happy to go ahead with it. Everybody I've spoken to here in the UK are saying, yeah, definitely. Because what we do know is that COVID-19 gives blood clots and these can kill. So obviously we'll all be waiting for the results of the EMA decision in a couple of hours' time. But it's definitely the advice at the moment, certainly here in the UK, is to go ahead and be vaccinated with the AZ vaccine.
Thank you so much, Nicola Hill. And of course, we'll bring you that news here on TRT World. Thank you.